Hello and welcome. Today we're delving into a rare and often devastating heart disease called pulmonary veno-occlusive disease, or PVOD. This condition affects the small veins in the lungs, leading to high blood pressure and ultimately right heart failure. Join us as we explore its causes, symptoms, diagnosis, and what can be done to manage this challenging disease. The exact cause of PVOD remains largely unknown, making it a diagnostic and research challenge. In some cases, genetic mutations, particularly in the EF2K4 gene, have been identified. Exposure to certain chemotherapy drugs, bone marrow transplantation, and some autoimmune conditions have also been implicated as potential risk factors. However, for many patients, the trigger remains a mystery. PVOD is characterized by progressive blockage of the small pulmonary veins. This narrowing and obstruction are caused by thickening of the vein walls, often due to fibrous tissue growth. This obstruction increases resistance to blood flow exiting the lungs, leading to pulmonary hypertension, high blood pressure in the pulmonary arteries. Over time, the right side of the heart has to work harder to pump blood through the constricted vessels, eventually leading to right heart failure. PVOD is a rare disease, making it difficult to determine its true prevalence. Estimates suggest it affects fewer than 1 in a million people. It can occur at any age, but it is most commonly diagnosed in young adults. It's important to note that PVOD is frequently misdiagnosed as other forms of pulmonary hypertension, further complicating the accurate assessment of its epidemiology. The signs and symptoms of PVOD are often similar to those of other types of pulmonary hypertension, making early detection challenging. Patients may experience shortness of breath, particularly with exertion fatigue and dizziness, chest pain, swelling in the ankles and legs at edema, and a persistent cough are also common. In some cases, patients may cough up blood, known as hemoptysis. Diagnosing PVOD requires a comprehensive evaluation. Initial investigations typically include a chest X-ray and echocardiogram to assess the heart's function. A high-resolution CT scan of the chest can reveal characteristic features like enlarged pulmonary arteries, small lung size, and thickening of the interlobular septa, which are the walls between the lung lobules. However, the gold standard for diagnosis is a lung biopsy. This involves taking a small sample of lung tissue to examine under a microscope, confirming the venous occlusion and characteristic pathological changes. While there aren't distinct types of PVOD in the same way there are for some other diseases, it's important to distinguish between idiopathic PVOD, so where the cause is unknown, and PVOD associated with specific risk factors, such as genetic mutations or exposure to certain toxins. This distinction can be important in understanding the disease's progression and potential treatment options. Unfortunately, there is no cure for PVOD. Treatment focuses on managing the symptoms and slowing the disease's progression. Medications used to treat other forms of pulmonary hypertension are often ineffective and may even be harmful in PVOD. In some cases, diuretics are used to reduce fluid buildup, and oxygen therapy can help improve breathing. The definitive treatment option for eligible patients is lung transplantation. Given that the exact cause of PVOD is often unknown, specific preventative measures are difficult to implement. Avoiding known risk factors, such as unnecessary exposure to chemotherapy drugs, may be helpful. Genetic screening may be considered for individuals with a family history of pulmonary hypertension. The prognosis for patients with PVOD is generally poor, and the disease can progress rapidly. Without lung transplantation, survival is often limited to a few years after diagnosis. Lung transplantation offers the best chance for improved survival and quality of life. Recent research is focused on identifying new drug targets and therapies that can effectively slow disease progression and improve outcomes for individuals with PVOD. Scientists are also actively studying the genetic basis of the disease to improve early diagnosis and targeted treatments. The hope is that, with continued research, we can develop more effective treatments and ultimately, a cure for this devastating condition.